UK Healthcare Community Connection is sponsored by UK Healthcare.
8:24, we're joined by Josh Steiner and Jeanne Hartman from the UK Weight Loss Surgery Center.
They're both here this morning to tell us about some of the benefits that come from this kind of surgery. Thank you both for being here.
Well, thank you for having us.
This is obviously something that many people consider.
Absolutely.
What goes into making a decision like this?
So, as the surgeon, I recommend this surgery for patients who are about 100 pounds overweight and want a permanent, lifelong, durable weight loss that should hopefully get them healthier, get them more active, and really sustain for the rest of their life.
What kind of procedures are available?
At the University of Kentucky, we perform laparoscopic gastric bypass and laparoscopic sleeve gastrectomy surgery, and revisions from other operations to bypass surgery.
And what makes you a good candidate for either of those?
So we want you to be healthy enough to undergo any other operation, like a gallbladder or any other sort, be able to walk the length of a hallway, but just really want to have the durability of a long-term weight loss solution that won't require lifelong medication requirements.
Jeanne, you've been through this process, correct?
Yes.
What was it like for you, and how good does it feel afterward?
Oh, the biggest regret I have is not doing it sooner. My life has changed so much. I was over 100 pounds overweight, and the big thing for me happened when I saw a photograph of me at a race, and I couldn't really run it. All I could do was walk some of it, but a photograph showed up on the Facebook page, and I couldn't believe that was me, and I knew I had to make the change then. And I knew a friend who had had the surgery, and she'd had great success with it. So I talked to my primary care, and she suggested I contact Dr. Steiner's office. And it took about a year from my decision till I had the surgery, and it wasn't without fears, but I just made that first step, and they made it easy for me the rest of the way.
How long ago did you have the surgery?
December of 2023.
And you mentioned how it's changed your life. How so?
So before I had my surgery, I would literally dream of running. Just in my dreams, I could run races. I could run on the streets, and I couldn't do that in real life. I could hardly walk a mile. I ran my first half marathon in May, about a year and 5 months after my surgery.
That's incredible.
And I have my next one coming up in November. And I have a great run club that we meet several times a week together. I have new friends. Life's just easier now in many aspects. And it's just, I love living life now.
We have about 20 seconds left.
Okay.
What would your message be to people out there who are considering what Jeanne went through, but might be a little hesitant?
Well, I think that if you weren't a little nervous or aren't a little nervous about undergoing surgery, then I'd wonder. Everyone should be a little concerned, but knowledge is power. So make the phone call, go on our website at the University of Kentucky, learn about the procedures. They're very safe, they're very data-driven, and we really change a lot of people's lives. It's been the most rewarding thing I've ever done in medicine is bariatric surgery.
Well, thank you both so much, and good luck at your next half marathon.
Thank you.
That's right.
Some information on your screen about UK Healthcare, and we will be right back with the last 30 minutes or so of our newscast after the break.